Every day, doctors across India see dozens, sometimes hundreds of patients. They are overworked, under pressure, and expected to make critical decisions in minutes. Here's the reality: a busy physician may get less than 3 minutes per patient. In that time, they're supposed to recall thousands of conditions, connect scattered symptoms, and somehow not miss anything. But they do miss things. Not because they're bad doctors, because they are human. So we asked a single question: what if every doctor had a clinical co pilot? Not something that replaces the judgment, but something that sharpens it. Something that tracks what humans can't and surfaces what matters the most. That's exactly what we have built. The dashboard, the command center. This is the command center. The moment a clinician logs in, they see everything that matters instantly: patient load, number of analysis, system health. And here, this graph, it tracks two things doctor actually care about: time saved per day and the clinical care clarity. Over the past week are trending upward. That's not marketing. That's the measured improvement. The philosophy is simple. Reduced cognitive load, a doctor shouldn't dig through menus. They open the screen and within seconds they know where they stand. Now let's move to the people who matter the most, the patients. All patients screen. Here's everyone currently in the system. Each one is a real case, a real story. Notice how clean this is: name, age, gender, nothing extra. Doctors don't need paragraphs, they need the recognition. Search is instant. Type a name and results filters in real time. Adding a new patient? One tap, basic details, and done. No long form, no wasted clicks, because in a busy clinic, seconds matter. Let's open one patient, Jenny. Patient detail, the recovery trajectory. This is one of the most powerful parts of the system. You're looking at Jenny's recovery over her five last visits. Each figure is a visit. The fill shows recovery. The colors tells the story. Red indicates critical. Amber shows that it needs attention. Yellow symbolizes stabilizing. Green says improving. And teal refers to be recovered. Jenny started with concerning symptoms, then stabilized, then improved, and now fully recovered. Every arrow pointing up. Most systems show snapshots. The story that shows the journey. New analysis. Now imagine a patient walks in with fever, cough, and breathlessness. The doctor enters the symptoms 15 seconds and clicks analyze. What comes back is not a answer. It's a ranked set of possibilities. Analysis results, differential diagnosis plus graph. Here's where clarity really matters. Differential diagnoses are shown visually with confidence levels. No pretending there's only one answer. Pneumonia says high confidence. Acute bronchitis, medium, and other conditions, lower but visible. Each diagnosis explains why it appears. This matches how doctors actually think, but it goes further.
Something we were very intentional about. Doctors shouldn't be asked to trust and answer blindly. With a single check, the doctor can open the original Medline Plus document this conclusion is based on. Not a summary, not an interpretation, the actual medical reference directly from a trusted source. This turns AI from a black box into a transparent assistant. You can verify it, challenge it, or simply use it as a confidence support, all without leaving the workflow.
Missing information and the recommended tests. The system clearly shows what's missing: the blood group, the blood work, imaging, and key data gaps. It's not just answering questions, it's guiding the next step. Recommended tests are prioritized, not generic. The clinical reviews this in under a minute, saving time that would otherwise be spent recalling the guidelines or second guessing. Follow up in context aware question and answering. If the doctor needs clarification, they ask a follow up. The response is strictly grounded in the patient's data. No hallucinations, no speculation, just contextual support. Clinical feedback that is the human in the loop. And this is critical. Every AI response can be reviewed. If it's accurate, the doctor confirms it. If it's wrong, then they correct it. That response is marked as a clinician reviewed. This is not bland AI, it's a supervised intelligence. PDF export. Needs documentation? One tap generates a complete clinical report. Symptoms, diagnosis, confidence, and recommended tests. Formatting, professional and ready to share. No extra work, just faster work. Analytics scream the proof. Finally, analytics. Diagnosis distribution, case trends, AI confidence, patient volumes over time. These aren't the decorative charts. They show that time is being saved, clarity is improving, and that decisions are becoming safer.
Also provide doctors with disease level analysis of their patients, where they can directly use to monetize their practice. By understanding which conditions are most common, doctors can plan diagnostic services, decides which tests to offer in-house, and guide affiliated pharmacies on which medicines to stock. If gastro cases are consistently high, setting up an in-house diagnostic test becomes a logical next step. If cardiac medications dominate, affiliated pharmacies know exactly which medicines to stock, reducing the shortages and wastage. In short, the system doesn't support care, it helps us to align services, labs, and pharmacies with real patient demand. That's how data moves from insight to impact.
Impact. Here's what this really means. Doctors reclaim hours every day. Juniors, clinicians get decision support they have never had before. And patients who might have been missed aren't. This isn't about replacing the doctors, it's about giving them superpowers. Clinical AI isn't coming, it's already here. And this is just the beginning. Thank you.